A heart attack is one of the most frightening medical emergencies a person can face, especially after the age of 60 and when it happens while you are alone. As we grow older, heart attack symptoms often become less obvious, more unpredictable, and easier to dismiss as everyday aches, fatigue, or stress. Many seniors delay taking action because they hope the feeling will pass, fear being a burden, or simply don't realize what is happening until precious time has already been lost. Unfortunately, those lost minutes can mean the difference between survival and serious, permanent heart damage. The truth is that most heart attacks do not happen in hospitals. They happen at home, quietly, and without warning. That is why knowing exactly what to do in those critical first moments is just as important as medical treatment itself. This guide is designed specifically for seniors over 60, with clear, practical, and life-saving steps that can be followed even under stress. These 7 tips focus on awareness, fast decision-making, and simple actions that protect the heart while emergency help is on the way. You do not need medical training to save your own life. You only need knowledge, preparation, and the confidence to act quickly. Whether you live alone or spend long hours by yourself, understanding these steps today could give you the power to survive a heart attack tomorrow. Recognizing the warning signs of a heart attack early is one of the most important and life-saving steps for adults over 60, especially when you are alone. Unlike the dramatic chest-clutching scenes often shown in movies, heart attacks in seniors can begin quietly, subtly, and without severe pain. Many older adults experience symptoms that feel mild, confusing, or unrelated to the heart, which is why they are often ignored or mistaken for common issues such as indigestion, fatigue, anxiety, or muscle strain. While chest discomfort is still the most common sign, it may feel like pressure, tightness, fullness, squeezing, or burning rather than sharp pain. This discomfort can last several minutes, come and go, or spread to other parts of the body such as the left arm, shoulder, neck, jaw, upper back, or even the stomach. Shortness of breath is another critical warning sign, and it can occur with or without chest discomfort. Many seniors suddenly feel winded while resting or doing very light activity. Other early symptoms may include unexplained sweating, lightheadedness, dizziness, nausea, or vomiting, which are especially common in older adults. Extreme or sudden fatigue is another overlooked sign. Some seniors describe it as a crushing exhaustion that appears without warning and does not improve with rest. There may also be a strong sense of anxiety, unease, or a feeling that something is very wrong, even if you cannot pinpoint pain. Women and seniors are particularly likely to experience these atypical symptoms, making awareness even more crucial. The danger lies in delaying action. Many people wait, hoping symptoms will pass, or convince themselves they are not serious enough to require emergency help. This delay can lead to extensive heart damage or death. The heart muscle begins to suffer irreversible injury within minutes when blood flow is blocked, so recognizing symptoms early dramatically improves survival and recovery. Trust your body and your instincts. If symptoms are sudden, unusual, persistent, or worsening, they should never be ignored. It is far better to call for help and be wrong than to wait and risk permanent damage. For seniors living alone, recognizing early warning signs is not just about awareness. It is about giving yourself the chance to act while you still can. Early recognition leads to faster emergency response, quicker treatment, and a much higher chance of survival. Calling emergency services immediately is the single most critical action to take when you suspect a heart attack, especially after the age of 60 and when you are alone. Many seniors hesitate at this step, hoping symptoms will fade or worrying about overreacting, medical costs, or bothering others. However, heart attacks are medical emergencies where every minute matters. The faster emergency care begins, the greater the chance of survival and the less damage to the heart muscle. Delaying even 10 to 15 minutes can significantly worsen outcomes. When symptoms appear, whether chest pressure, shortness of breath, dizziness, or unexplained discomfort, the correct response is to call 911 or your local emergency number immediately. Do not call family members, neighbors, or friends first. and do not attempt to manage the situation on your own. Emergency dispatchers are trained to recognize heart attack symptoms and can guide you step by step while help is on the way. Put your phone on speaker so you can follow instructions without strain and stay on the line unless told otherwise. The dispatcher may ask you to unlock doors, take aspirin if appropriate, or adjust your position to stay safe. Emergency medical services are equipped to begin life-saving treatment the moment they arrive, including oxygen, medications, heart monitoring, and defibrillation if needed. This early intervention can prevent cardiac arrest and dramatically improve survival chances. Another critical reason to call emergency services is speed. Ambulances are prioritized in traffic and take you directly to the most appropriate hospital, often one equipped to perform emergency heart procedures. Arriving by ambulance also ensures the hospital is prepared for your arrival, saving precious time once you get there. Many seniors consider driving themselves or waiting for someone else to arrive, but this can be extremely dangerous. Symptoms can suddenly worsen, leading to collapse or loss of consciousness. Driving yourself puts your life and others at risk. It is also important to remember that heart attacks do not always cause severe pain. Mild or fluctuating symptoms can still signal a serious blockage. Waiting to see how it goes is one of the most common and deadly mistakes. If you are alone, calling emergency services is your lifeline. Even if you feel uncertain, professionals would much rather respond to a false alarm than arrive too late. Acting quickly shows strength, not fear. By calling emergency services immediately, you give yourself the best possible chance to survive, recover, and return to a healthy, independent life. Chewing an aspirin during the early moments of a heart attack can be a simple, yet highly effective step to reduce heart damage, but it is crucial that seniors only do so if their doctor has previously approved aspirin use. Aspirin works by thinning the blood and preventing platelets from clumping together, which helps keep blood flowing through blocked or narrowed arteries during a heart attack. This can slow the progression of a clot and minimize the amount of heart muscle that is damaged while waiting for emergency medical care. For seniors over 60, this step can be especially valuable because older adults are more prone to blocked arteries and delayed symptom recognition, making early intervention vital. If your doctor has advised that aspirin is safe for you, the recommended method is to chew one regular 325 milligrams tablet or, if appropriate, a low-dose 81 milligrams tablet. Chewing allows the aspirin to be absorbed faster into the bloodstream than swallowing it whole, so it can begin acting within minutes. It is important to avoid swallowing the pill without chewing because this delays absorption and reduces its immediate effectiveness. However, aspirin is not safe for everyone. Seniors who have a known allergy, a history of gastrointestinal bleeding, stomach ulcers, or other medical conditions may be advised against taking it. It is critical to know your personal health limitations and follow your doctor's guidance exactly. If you're unsure whether aspirin is safe, it is better to call emergency services first and ask the dispatcher for advice rather than risk complications. Taking aspirin does not replace any other steps, such as calling 911, staying calm, or preparing for emergency responders. It is simply an additional, immediate action that can improve survival and reduce long-term damage. In practical terms, keeping a few aspirin tablets in an accessible location at home, such as near your phone, bedside, or kitchen, can make this step quick and simple during a sudden emergency. Many seniors living alone find that this small preparation can make them feel more in control and reduce panic if a heart attack strikes. Remember that aspirin only helps in certain types of heart attacks caused by blood clots in the arteries. It is not a cure and must be followed by professional medical treatment. The combination of early recognition of symptoms, immediate emergency contact, and aspirin, if approved, significantly increases the likelihood of surviving a heart attack and reducing permanent heart damage. Chewing aspirin is a small action with potentially enormous impact, an accessible, low-cost measure that seniors can prepare for in advance, giving them a proactive tool to protect their heart when every minute counts. When experiencing a heart attack, especially after 60 and when alone, sitting or lying down and maintaining calm is a critical life-saving step. During a heart attack, The heart struggles to pump blood effectively, and any unnecessary physical activity or stress can increase the heart's workload, worsen damage, and trigger dangerous complications such as cardiac arrest. By sitting upright or lying down with the head slightly elevated, seniors can reduce strain on the heart, ease breathing, and lower the risk of fainting or falling. It is important to avoid sudden movements, lifting objects, or walking around, even if symptoms feel mild. Loosening tight clothing, such as belts, buttons, or restrictive shoes, can help improve comfort and circulation, making it easier for the heart to work under stress. Staying calm is equally essential. Anxiety, panic, and rapid breathing elevate heart rate and blood pressure, which can exacerbate the heart attack and increase oxygen demand in an already stressed heart muscle. Seniors can use simple techniques such as slow, deep breaths, focusing on counting each inhale and exhale, or mentally repeating reassuring statements like, "Help is on the way," to stabilize heart rate and reduce panic. Preparing your environment while remaining seated or lying down is another key step. Keep your phone within reach, unlock doors if possible, and turn on lights for emergency responders, all while minimizing movement. Even small actions can make a huge difference if help is delayed by traffic or other emergencies. It is also vital to remain conscious of body position. Lying flat can sometimes make breathing more difficult, especially for seniors with heart or lung conditions, so keeping the head and upper body slightly elevated is generally safer. This position also reduces the risk of aspiration if nausea occurs, which is common during heart attacks in older adults. Remember that every second of calm, measured action contributes to survival. Many seniors make the mistake of attempting to push through pain, move around the house, or perform tasks, believing they can manage alone. Unfortunately, such activity can be deadly. Sitting or lying down and maintaining calm allows the heart to conserve energy, improves blood flow to vital organs, and gives emergency personnel a better chance to stabilize the situation once they arrive. In essence, this step is about protecting the heart, maintaining safety, and buying critical time until professional care is available. It may feel passive, but it is one of the most effective actions a senior can take to survive a heart attack while alone. Combining this with early symptom recognition, calling emergency services, and, if approved, taking aspirin forms a strong, life-saving response plan that every senior should know and practice mentally in advance. One of the most dangerous decisions a senior can make during a heart attack is attempting to drive themselves to the hospital. After 60, the heart is often more vulnerable, and symptoms such as dizziness, chest discomfort, shortness of breath, or sudden fatigue can intensify without warning. Driving in this state is extremely risky, not only for the person experiencing the heart attack, but also for everyone else on the road. Loss of consciousness, sudden cardiac arrest, or a sharp surge of pain can happen in seconds, leaving no time to react. Emergency medical services, EMS, are trained to respond rapidly and provide critical care en route to the hospital, something a personal vehicle cannot offer. Ambulances are equipped with oxygen, cardiac monitoring, defibrillators, and trained personnel who can immediately stabilize heart function, administer medications, and communicate with the hospital to prepare for your arrival. Every minute in an ambulance is a minute closer to saving your heart muscle and possibly your life. Driving yourself not only delays this critical care, but also increases the risk of a fatal accident, which could compound the emergency situation. Many seniors think that a hospital nearby makes it safer to drive, but heart attacks do not follow predictable patterns. They can worsen suddenly, even on short trips. Additionally, the stress of driving while in pain or fear can raise your blood pressure and heart rate, putting even more strain on a heart that is already under attack. Waiting for emergency responders or asking someone nearby to call 911 is the safest and most effective option. If you're alone, this means calling emergency services immediately, sitting or lying down, and keeping your phone within reach. Even if you feel capable of driving, remember that ambulances are faster, safer, and provide immediate medical intervention. Some seniors hesitate because they worry about bothering others or facing medical costs. But the risk of attempting to drive far outweighs these concerns. Emergency services are designed precisely for situations like this, to provide rapid, professional care and ensure you reach the hospital safely. By resisting the urge to drive and relying on trained responders, you not only protect your life, but also reduce stress and increase your chances of surviving the heart attack with minimal long-term damage. In essence, not driving yourself is not a sign of weakness. It is a critical, proactive step in self-preservation. Combining this decision with early symptom recognition, calling emergency services immediately, staying calm, and following other prepared steps forms a comprehensive action plan that every senior should memorize. Understanding and respecting this principle can literally mean the difference between life and death when facing a heart attack alone. When experiencing a heart attack alone after 60, unlocking doors and preparing for emergency help may seem like a small step, but it can have a major impact on survival. Emergency responders often lose precious minutes when they arrive at a locked home, and during a heart attack, those minutes can mean the difference between recovery and severe heart damage, or even death. If you're physically able, unlocking your front door, or at least leaving it partially open, allows paramedics to reach you quickly without having to force entry. This simple action can save critical time and reduce delays in life-saving treatment. Turning on porch lights or hallway lights, especially at night, helps responders locate your home faster and move safely inside. Keeping your phone nearby on speaker mode ensures you can continue communicating with emergency dispatchers and receive instructions until help arrives. Preparing for help also means positioning yourself where responders can easily reach you, ideally near the entrance or in a clear, open space, while still sitting or lying down to conserve energy. Seniors should avoid climbing stairs, moving heavy furniture, or searching for items, as unnecessary exertion can worsen symptoms and increase the risk of collapse. If possible, unlock interior doors as well, particularly bedrooms or bathrooms, since responders often lose time navigating tight or blocked spaces. Another helpful step is gathering essential information in advance or keeping it visible, such as a list of medications, allergies, medical conditions, and emergency contacts. Many seniors keep this information on the refrigerator or in a wallet, making it easier for paramedics to provide accurate treatment quickly. Sometimes hesitate to unlock doors due to privacy or safety concerns, but during a medical emergency, speed is far more important. Emergency responders are trained professionals whose only goal is to help you. By preparing your home and yourself for their arrival, you allow them to focus on treatment rather than access issues. This step works hand in hand with calling emergency services immediately, staying calm, and avoiding unnecessary movement. Together, these actions create a controlled environment where the heart can be stabilized as quickly as possible. For seniors living alone, mentally rehearsing this step in advance, knowing which door to unlock and where to sit, can reduce confusion and panic during an actual emergency. Unlocking doors and preparing for help may feel simple, but in a heart attack situation, it is one of the smartest and most protective actions you can take. Knowing your personal heart attack risk and preparing in advance is one of the most powerful ways seniors over 60 can protect themselves, especially if they live alone. Many heart attack deaths occur, not because help was unavailable, but because individuals were unprepared to act quickly when symptoms began. Personal risk factors such as high blood pressure, high cholesterol, diabetes, smoking history, obesity, family history of heart disease, and a sedentary lifestyle significantly increase the likelihood of a heart attack. Age itself is a major risk factor, which makes awareness and preparation even more critical for seniors. Understanding your own health profile allows you to take symptoms seriously instead of dismissing them as normal aging or minor discomfort. Preparation starts with clear communication with your doctor. Seniors should ask direct questions about heart attack warning signs, whether aspirin is safe for them, and what immediate steps they should take if symptoms occur. Having a personalized action plan removes uncertainty during a crisis, when stress and confusion can delay life-saving decisions. Another essential step is keeping emergency information easily accessible. This includes storing emergency numbers in your phone with speed dial access, placing a written list of medications, allergies, and medical conditions in a visible location, and informing close family members or neighbors about your health risks. Wearing a medical alert device or bracelet can be especially valuable for seniors who live alone, as it allows emergency responders to access critical information instantly if you are unable to speak. Preparing your living space is equally important. Keep pathways clear, ensure doors can be unlocked easily, and store aspirin, if approved by your doctor, in a known, accessible location. Mental preparation also plays a vital role. Seniors who mentally rehearse what to do during a heart attack are more likely to act quickly and calmly. This includes recognizing symptoms, calling emergency services immediately, sitting or lying down, unlocking doors, and avoiding dangerous actions like driving. Preparation reduces panic and increases confidence, allowing you to focus on survival rather than decision-making under stress. It is also important to regularly reassess your risk as health conditions change over time. What was safe 5 years ago may no longer be appropriate today, so ongoing communication with healthcare providers is essential. Ultimately, knowing your personal risk and preparing in advance is about taking control of your health and independence. It transforms a frightening, unpredictable event into a situation where you know exactly what to do. For seniors over 60, preparation is not fear-driven. It is empowerment. By planning ahead, you give yourself the best possible chance to survive a heart attack, reduce long-term damage, and continue living a full, active life with confidence and peace of mind.